Hello and welcome to this channel. This video is primarily for individuals who want to know about diabetic comprehensive diabetic care. And this video is helpful primarily for families with a member of diabetic patient and for individuals who know patients with diabetes and as well for healthcare providers and healthcare professionals. So in next few minutes, we will try to see what the comprehensive diabetic care should include. So we have four pillars. We have four pillars of diabetic care. So the comprehensive diabetic care should include four pillars. Four pillars. From the four pillars, the first one is nutritional importance. Nutrition. So when you think of diabetes, nutrition is very important for glycemic control. So we need to take care of the meal that the diabetic patients take. So if we don't try to control the meal, the feeding of diabetic patients, we forever we are not able to control the blood sugar level of the patient. So nutrition is very important. So there is what you call diabetic diet. Diabetic diet primarily it includes vegetables and cereals and some other foods which are not primarily direct glucose containing foods. So vegetables and cereals are primarily they are the first choice for diabetic patients. And the other important pillar for diabetic patients is physical activity. Physical activity Physical activity has multi-directional important roles for diabetic patients. One, it increases sensitivity of the body tissue for some drugs, for example, like for metformin, for insulin, and other anti-diabetic drugs. The sensitivity of body tissue for these drugs are increased by physical exercise. So individual, especially diabetic patients, should have at least 30 minutes daily physical activity. So 30 minutes daily physical activity has a significant role for improving the blood glycemic level of the patient. And the third important pillar for diabetic patient care is the medication. The medication. So the patient should take the medications as it is prescribed by the physician. So the medication could be in injection form or it could be in PO or in oral medications like oral hypoglycemic agents like metformin or sulfonyl urate group of drugs like glibenclamide, glyburide. These drugs are important for managing diabetic patients. The other important thing under the medication pillar is insulin. Insulin needs technical assistance because the patient should know how to take insulin injection and the patient should know to take the injection by himself or by herself. So we should teach the patient how to take the insulin. In the next video, we will try to see the techniques of insulin injection and what are the risks that we should take care of when taking insulin and what are the important mistakes that some patients do while taking insulin. And this is the third pillar. And the fourth pillar is monitoring, monitoring of the patient's condition. So the patient has to have monitoring parameters as well as should have a regular schedule, with his or her physician and in a healthcare facility. So during monitoring, the blood sugar level should be monitored regularly while doing exercise, while resting time. It should be specifically known what is the maximum level that the patient's blood glucose level reaches, and the minimum should also be known because hypoglycemia is more grave, more severe than the hyperglycemia. So the patient should know the maximum glycemic level of the patient and the minimum glycemic level while the patient is at rest as well as while the patient is doing physical activities. So in monitoring, the other important thing is so we should monitor, we should follow the chronic complications of the diabetes. Chronic complications of diabetes should be screened always, should be screened always. The important organs that are primarily damaged by diabetes is one is the eye. The patient should be screened for his ophthalmologic healthy at least twice within a year, at least twice within a year. If the ophthalmologic the eye of the patient is healthy, at least he or she should take screening at least twice a year. The other important organ that should be screened is the kidneys, because kidneys are one of the most important organ that is being damaged by diabetes. And in fact, in fact, diabetes is the most common cause of chronic kidney disease worldwide. So we should follow the renal condition of the patient always while we are monitoring the diabetic patients. So when we monitor the diabetic patients renal condition, we should know the proteinuria, which is very important. The proteinuria should be treated, should be identified early, and it should be treated. The other important organ that should be monitored while we are following the patient with diabetes is the kidneys as well as the artery, I mean peripheral arteries, the heart of the patient, and as well the neuropathies, especially peripheral neuropathy, which is the common complication of diabetes. One of the chronic complications of the diabetes is uh, peripheral arterial disease, and also the on the heart it has also significant damage that may reach up to myocardial infarction and also chronic ischemic heart disease is also a common complication that's associated with diabetes, and also neuronal problems like peripheral neuropathy, which is the common presentation of patients with diabetes. So these chronic complications should be monitored in a patients with diabetes. So all these are a brief explanation of comprehensive diabetic care. So in the next video, I will try to present about the insulin injection, how the patient should take the insulin injection, and the importance of insulin injection over oral hypoglycemic agents, and what are the importance of oral hypoglycemic agents as compared to insulin, and also what are the risks that are associated with insulin injection. We'll try to explain all these things in the next video. uh, Family, please try to share this video, and please, I need your subscription to develop this channel so that this health education can reach for a lot of people, because it is helpful for some individuals who may have diabetes and family members with diabetes. Thank you very much. I love you all.